If you could snap your fingers today and implement the best possible healthcare system for the United States of America, what would that look like?
Well, we have a pretty good system, not great, but a pretty good system in Medicare. So it's there for the elderly, and Lyndon Johnson passed that in the 1960s, a huge step forward. It is being chopped away by the private insurance companies through Medicare Advantage. But if you strengthen Medicare and you do away with the kind of deductibles that seniors now have to pay, and you do away with other stuff, and you say basically right now you're a senior in America, you go to any doctor you want, when you're in the hospital, Medicare will pay the entire bill. If you expand Medicare to cover dental, hearing, and vision, which it doesn't now cover, you do all of those things. And then the next thing you do is say, okay, to be eligible for Medicare now, you have to be 65. First year, we're going to lower it to 55. Then we'll lower it to 45. Then we'll lower it to 35. Then we'll have everybody in the system. So I think in a 4 or 5 year period, you can strengthen Medicare and have everybody in the system. And when you do that, and this is not just me talking, a number of studies have pointed this out, when you take the profit motive out of it from the insurance companies and the drug companies, you can end up providing quality care to all people at no more than we're spending right now. Because right now, we are spending twice as much per person in healthcare as the people of any other nation. Incredibly wasteful system.
So the way to pay for the system is to increase taxes. But you're saying if you cut that cost and increase the taxes, you're saying it's going to balance itself out.
Here's the story. And I've gotten my share of 30-second ads attacking me on this. Bernie Sanders wants to raise your taxes on healthcare. It's true, in a progressive way. But right now, do you have health insurance?
Yes.
Okay. Somebody's paying for your health insurance. It depends. If you are working, most people get their health insurance through their jobs, okay? So if you're working for a large company, your employer is paying your health insurance. And by the way, that comes out of your wages. Healthcare costs in America are very high, and your employer will tell you honestly, look, I can't give you more than a 3% wage increase because I got a 10% increase in your healthcare costs. You want that? Or if you're a union negotiating, you know what they'll say? Hey, you want decent wages? We're going to have to cut back on your healthcare. That's what every union has to deal with, every negotiating session. So we're paying for it through employers out of pocket. We pay through it through Medicare, Medicaid, Veterans Administration, etc. What I am proposing is really not radical. It's what exists in Canada and other countries. It is publicly funded, like the police departments, and like libraries are, like public education. This is publicly funded in a progressive way. So right now, rather than paying out of your own pocket, if you are a family, let's just say you're self-employed right now, and you are, you have a couple of kids and a wife, it could cost you $15,000, $20,000 a year in insurance costs. Well, that's all eliminated. Will you have to pay more in taxes? Of course you will. Maybe it depends on your income level, but it could be that you'll be paying $12,000 more in taxes, but not $20,000 more in premiums, co-payments, and deductibles. You save money. So it's paying taxes rather than paying money to the insurance company. You got a better deal through the tax system.